Hey everyone, my name's Kai. I'm a physiotherapist and exercise scientist. Today I'm just going to briefly chat about patellofemoral pain syndrome and hip strength and show a few exercise examples. So we know that in runners, knee is the most common area that gets injured, and out of that, patellofemoral pain is probably the most common injury to the knee and one of the most common injuries seen in runners, along with other athletes. There's a large range of studies showing that rehabilitation is effective at managing patellofemoral pain, among other things including education, load management as well. Studies have shown that strengthening both the hip and the knee around that are both effective, and hip and knee strengthening, hip-based strengthening is looking at primarily gluteal muscles, and knee-based strengthening is looking at primarily quadriceps muscles. It's been found in studies that if you combine hip and knee strengthening, that it's more effective than doing just knee strengthening on its own. Studies found that starting rehabilitation with hip strengthening in isolation had a faster reduction of pain than starting with knee strengthening in isolation. So this may be relevant when you're looking at patients that are irritable, especially if they've got an irritable patellofemoral joint. And studies have also shown that runners with patellofemoral pain have a reduction in their strength of their hip abductors, or primarily their glute muscles. And a study also found that runners commencing a running program, if they had a higher hip abduction strength, that a reduced risk of developing patellofemoral pain. So what this tells me is that rehab works. We need to probably look at knee and hip based strengthening, so our glutes and our quads primarily, and that potentially with an irritable athlete, looking at starting with the hip exercises first may be more important. Now, what I haven't chatted about here, and it's not the focus of this video, I haven't chatted about knee-based strengthening, I haven't chatted about load management, education, which are all crucial parts of managing patellofemoral pain. So keep watching. I'm now going to just put up a few examples of some good hip-based strengthening exercises that you can use for patellofemoral pain rehabilitation. These are only examples, and please note this is only general advice, not medical advice. It's recommended for you to see an appropriately qualified and experienced physiotherapist or health professional to manage your knee pain. If you want more information, I have put a post about patellofemoral pain and hip strength on my social media at KaiWin Physio, and also a blog post at kaiwin.com/blog.